Good. Looks like everything is going. Looks like the sound is on. Everyone can hear me, hopefully okay. And we are live. Hello, everyone. Happy Saturday. We are flying through the month of March in such a fury. And I'm so happy that we're going to take a few moments on this Saturday to really talk about some, not just in my opinion, life-changing, but in many instances, life-saving information about lupus and kidney health. So welcome, everyone. We are getting started, right, shot out of a cannon here. So I'm thrilled to be live with you today and bringing back our special guest. Welcome, and thank you for joining us for this special educational symposium entitled How to Prevent Lupus Nephritis, Onset and Flares. Yes, if that doesn't get your attention, I don't know what will. This is going to be a special live virtual event in honor of National Kidney Month and in collaboration with the author of the Lupus Encyclopedia and the creator of www.lupusencyclopedia.com, Dr. Don Thomas. My name is Kelly, and I'm the creator and executive director of the Portland-based nonprofit More Than Lupus. And one thing that I decided before we went live today is I was going to do a giveaway, which is what we usually do. But you know, I went on Amazon and this book is so reasonably priced that we're going to do a drawing for everyone who shares this today for a copy of the second edition. You'll get a brand new one. You won't get one with all my beautiful notes in it that I love to go back and reference. But yes, you will get your copy of the Lupus Encyclopedia, second edition. It's absolutely a must-have for anyone who lives with lupus or knows someone with lupus and you want to support them. It's also a great handbook for primary care physicians, any other medical professionals who want to dig a little bit deeper. This is the book for you. But that being said, if you're unfamiliar with us and More Than Lupus, we are a multi-ethnic, multi-generational, and international lupus community designed by lupus patients and led by lupus patients to connect and to grow and to inspire each other through the peaks and the valleys of our lupus journey. And I say our because I'm a pediatric lupus patient and I've had lupus for 33 years. Now, we believe that every person living with lupus, no matter their background, should be treated with equity and dignity and taken seriously. And that is continuing to be our mission here, that patients feel heard, that they feel seen, and that they feel valued, and to remove as much as possible barriers to care, which is why we offer access to some of the top rheumatologists here for free on our educational symposiums. We hope the information provided today not only helps you, but if you're here to support somebody in your family, it helps support your family as well. There will also be a question and response time at the end of Dr. Thomas's presentation. So please take notes. If there's anything that you came to ask him, don't forget to do that. You can post them in the chat box now. Tell us where you're joining from, what questions and comments you have, and we'll do our best to get through what we can get through in this hour. Just want to remind you, though, that this is live on Facebook and YouTube. And sometimes this will get shared in spaces it shouldn't be, and we'll see maybe some spam or whatever. It's very rare, but every once in a while, I see it, I get rid of it, and I will tell you my little jingle. Don't engage, refresh your page, right? Don't spend any energy engaging. I see it and get rid of it for you. So please just keep all comments positive, and any inappropriate material will be deleted. As I mentioned, we're giving away a copy of the Lupus Encyclopedia, which will be shipped to you. You do have to live in the US, though. I've tried it before. It's a little bit tricky. So if you share this and write share it in the comments, you will be entered into the drawing at the end to win a copy of this wonderful book. So before I introduce and bring back our special guest, let me do this brief disclaimer for you. Please understand that the opinions shared today are purely for informational purposes and do not replace the medical advice and or opinions of your doctors. If you're experiencing lupus or lupus nephritis or lupus overlap symptoms, it is important to follow up with your doctor and seek the treatment that is best for you. Dr. Thomas is a qualified professional with many years of patient experience. However, he is not liable for his comments since he is not acting as your personal physician or health advocate. So, some statistics vary, but it is believed that roughly 45% of people with systemic lupus will develop lupus nephritis. And it is time that we, as a patient community, delve deeper into this topic. And I am thrilled to have back with us again, here he comes, Dr. Don Thomas, our resident roomie and author of the Lupus Encyclopedia here in its second edition to lead this conversation. Hello, Dr. Thomas.
Hello, Kelly, and thanks for having me on this beautiful Saturday. It's beautiful here in Washington, D.C.
Oh, well, it stopped raining for a second here in the Pacific Northwest, so we're grateful for that. I know who you are, and as do many of the people who are watching this now live, but I thought maybe you could just take a moment or two to give an update about your background and tell us a little bit about yourself.
Sure, and just very quickly, I'm a rheumatologist who specializes in lupus and Sjogren's disease. I've been in practice for over 35 years, and my passion has really been to empower patients to know how to take better care of themselves, especially with autoimmune diseases. It entails much more than just taking medications, and so I like to spread that information. It drove me to write the book you just showed, the Lupus Encyclopedia, published by Johns Hopkins Press, and it's just full of lots of practical advice that people can take home and really put into practice to do better with themselves. And I love giving talks like this where I can share knowledge. So, Kelly, I got a question for you. Do you know what a computer bot is?
A computer bot, like AI?
Yeah, BOT. Like, I guess it's something that computers that can give false information on the internet. Literally, right before I signed on, one of my hydroxychloroquine posts on Blue Sky, someone posted and asked me if I was a computer bot, and if I do, I need to reveal myself. So I guarantee you, I am not a computer bot. I am real. I'm a real rheumatologist.
Well, I will say that might be a compliment considering that you were so quick to respond that they thought you were artificial intelligence.
Right. Well, anyways, my whole purpose for the next hour or so, hopefully less than that, is to give some practical advice, things that whoever's watching this can take home with them, and on YouTube, people who watch it later. And I have a medical disclaimer. I like your medical disclaimer, Kelly, but my medical disclaimer is as follows. If the people watching this do as I recommend, I guarantee you're going to do better than if you didn't. So how's that?
That's pretty good. That's pretty good because people who are being drawn to watch this today are going to want to hear if the title, there's information there, because the title is so catchy: How to Prevent Lupus Nephritis Onset and Flares. So you're going to tell us that we can actually have the power to prevent our kidney flares? That's
absolutely
amazing.
and the onset of it. And Kelly, people are much more likely to do things if they knew the reasons why behind those things. And so at the end, Kelly is going to post a list of references that back up all of the medical information I'm giving you. So if you question anything I tell you, I do have medical literature to back it up. But also I'm going to start off with reasons why you want to do the things I'm recommending. First, I'm going to tell you about how horrible lupus nephritis is, and then number two, what it can do if you don't take good care of it, and how often it occurs. So back in 2018 at the University of California, Los Angeles, doctors Yen and Singh, they scoured the entire United States database of deaths, and they asked the question, how often do rheumatic diseases play a role in death in women? What they showed was astounding. when you remove suicide and you remove trauma, systemic lupus erythematosus is the 16th most common cause of death in all United States women from the ages of 10 to 64, number 16. But it's worse than that. In young women, it's the 10th most common cause of death. And in our women of color from 15 years old to 24 years old, it's the 5th most common cause of death. And that's a travesty, and all of us should be angry about that because most Americans have never even heard of lupus. Yet they've heard of cystic fibrosis, muscular dystrophy, multiple sclerosis. Those diseases are not as common as lupus. And so I encourage everyone who watches this who has lupus or knows someone with lupus, please advocate for lupus. We need to teach the general public about how horrible it is so we can get people to donate and have good research so we can learn how to have better treatments and hopefully someday a cure and even better prevention. So, and the major driving force, by the way, of those deaths in young women is lupus nephritis. That's the number one cause of morbidity and mortality, and that's why today's talk is so important. But you know, lupus nephritis, it affects different demographics differently. And it has to do number one with genetics, but also environment as well, because we know that triggers such as the amount of sunlight people have, or vitamin D deficiency, exposure to smoking, or certain infections increases the risk of lupus developing. So for example, on one end of the overall, 45% of people with systemic lupus get lupus nephritis, like Kelly mentioned earlier. But when you look at different ends of the spectrum, when you look at those of Northern European ancestry, it's about a 20% of patients with systemic lupus get lupus nephritis. But when you look at a woman from the Caribbean with an African heritage, it's 80%. And so that's important to remember, is that it does vary between different populations. And then lastly, I just want to mention that the number one cause or the number one symptom in people who develop lupus nephritis, guess what that is? It's nothing. People who develop lupus nephritis have no idea they have it. Once they start to get symptoms of lupus nephritis, they're already having significant permanent kidney damage and decreased kidney function. And the reason I mention that is that this is the entire reason why we, as your rheumatologist, ask you to come in so often for lab work and blood work. Part of it is to look at how other parts of your lupus are doing. Part of it is to monitor make sure you're not having side effects from medications. But the number one reason is to get that urine sample and see if there's an excessive amount of protein in the urine, because that's how we can diagnose lupus very quickly and early. Now, how bad is lupus nephritis depending upon how you treat it? And this is a really important thing. A lot of times people with lupus, they'll be feeling really good, and then your rheumatologist will be sitting across from you saying, you know, but you're still having active lupus. I need to go up on your therapy, or I need to add something. And a lot of times there's a resistance to that. But we have very good reasons why we do it. And lupus nephritis is one of a really good example. And this comes from a study from 2008. It was a multi-center study written up by Dr. Chen. He was the chief author. He's from Rush in Chicago. But other major medical centers, such as the Cleveland Clinic, were also involved. And they asked the question, when we treat our patients with lupus nephritis, how well do they do depending upon if they go into a full remission, partial remission, or if they just have a slight response to therapy but don't go into remission? And the results were astounding. Those patients who went into a complete remission, we also call it a complete renal response, 10 years after their diagnosis of lupus or lupus nephritis, 95% of them were alive. So 5% of them died who went into complete remission. And that's actually really good for, and they looked at, by the way, they looked at only patients with very severe lupus nephritis, what we call class 4 diffuse proliferative nephritis. And all the patients were treated with cyclophosphamide, which is a chemotherapy agent. So of course they had severe disease and strong medicine that could lead to those particular deaths. So 5% of the patients died, but those who had a partial remission, those who were almost in complete remission, they had 24% of them died. 24%, 5 times more likely to die just by being in a partial remission compared to full remission. Now, those who had a response but not any remission parts of it, those patients just did horrible. There only 46% of them died, so most of them actually died. Now, how about end-stage kidney disease? Those patients who had to go on to dialysis. When you looked at those who went into complete remission at the 10-year mark, only 6% of them, went into end-stage kidney disease. But those who had a partial remission, in other words, almost close to a full remission, 55%, more than half, ended up on dialysis. And that is the reason why it's so important to learn how to prevent lupus nephritis from happening in the first place. And if you do develop it, how to make sure that you're one of those people that can possibly go into a complete remission. So next, I'm going to give you my tips and tricks, and there's going to be a total of 10 practical tips that I'm going to give you. So get ready with your pens and paper, or you could always go to YouTube to watch this later to get all of it under wraps. So first, let's go to that urine sample with the protein in it. That's what we get every visit you come in. We're looking specifically at something called the urine protein to creatinine ratio. If it's elevated above 200, that's high. If it's above 500 more than once, then those are the patients that we want to get a biopsy on. But the trick is you want to make sure that it's a good sample. So often, much of my day is taken up by me asking my medical assistant to call up patients to ask them to repeat their urine because I need to make sure that it was a proper collection and that they don't really have increased protein, because so many things can cause it. So number one, always do your urine first thing in the morning. The first or second void is the most accurate. Later than that, you can have falsely elevated protein levels. Number two, it needs to be what we call a midstream clean catch. This is the type of urine sample you want to get when you do a urine culture, but also to look at the protein, because if it's not done correctly, the protein can be artificially increased. What a clean catch, midstream catch is, you first want to urinate some of your urine into the toilet. Then you want to stop it. You want to put the cup underneath and then go ahead and get a sample of the midstream catch. But you don't want to get the last part of it. So the last part of it, you want to stop before you completely emptied, take away the cup, and then squirt the rest of your urine into the bowl, because those last few drops can give an artificial amount of increased bacteria or cells and protein in it. So that's tip number one, how to collect a proper urine. Tip number two, take that hydroxychloroquine religiously. Of course, we know that only 50% of our patients take their hydroxychloroquine. And the number one reason I get from my patients is that they don't feel like it makes them feel better. And it shouldn't, and it doesn't at first. It does in the long run when you take it religiously over time, especially with things like joint pain and energy levels. But for lupus nephritis, the importance of hydroxychloroquine is that those patients who take hydroxychloroquine religiously have a 3-fold increased chance of remission. Think about that. It's the safest drug that we have for lupus, and it increases remission rates 3-fold. We know that from a study from Johns Hopkins, led by Dr. Michelle Petrie and Dr. Fines and Castanon, and they showed this in their patients with lupus membranous nephritis. Now that's just one study. We always like to have more than one study. And just a couple of years ago, a large study from China reproduced similar results. They showed that in their patient population, hydroxychloroquine increased their chances of remission twofold. They were twice as likely to go into remission. And that helps keep you away from those steroids, which are the worst drug that we have for lupus, because everybody gets side effects from steroids. So tip number 3, take your vitamin D religiously. This is also one of those medicines and I do consider it a medicine for lupus. It's not really a vitamin, by the way, it's a hormone. Vitamin D helps to help the immune system work properly. Animal studies show that when we have animals that are deficient in vitamin D, their immune system becomes abnormal, similar to what we see with lupus. So this comes from a study also from Johns Hopkins, Dr. Michelle Petrie in 2006. She showed that when she took her patient population of over 1,000 patients with systemic lupus, tested them for vitamin D deficiency, over 700 of them were vitamin D deficient. She defined that as being less than 40 nanograms per milliliter. She then put all of them on weekly prescription vitamin D2, 50,000 international units, but also over-the-counter vitamin D3, a combination. And what she showed is that with that treatment, if she got the vitamin D level up by an additional 20 points and got it to 40 or higher, that those patients had a significant reduction in their urine protein level just by simply taking their vitamin D. Well, again, we don't like to just go by one study, but there's a couple other studies from Spain. We have a nice study that they took patients with cutaneous lupus, especially discoid lupus. Half of them, they didn't give them any treatment. The other half, all they gave them was over-the-counter vitamin D3. And they had a significant improvement in their cutaneous lupus simply by taking the vitamin D. And then there was Kelly mentioned earlier that she developed lupus when she was below the age of 18. 20% of our adult patients developed it when they were less than 18 years old, and they had the most severe lupus. Well, they did a randomized controlled trial in pediatric lupus patients and showed that those patients who were treated with vitamin D, and it was weekly vitamin D2, the prescription type, that they had a significant improvement in their disease activity and improvements in their energy levels. So please take that vitamin D religiously. What I do is I check the vitamin D level every 3 months, and my goal is to have it at least 40 nanograms per milliliter, up to 59 as the maximum. The reason for 59 as the maximum is that Michelle Petrie at Johns Hopkins recently did a study on lupus pregnant patients and showed that patients who had it above 59 had worse pregnancy outcomes compared to those who had it between 40 and 59. Those below 40, by the way, also had bad pregnancy outcomes. Next, tip number 4. Hydroxychloroquine decreases lupus nephritis flares. So you want to take that hydroxychloroquine. A Harvard study, it showed that those patients who took less than 5 milligrams per kilogram per day of hydroxychloroquine, which unfortunately is most patients, because I don't believe in that dosing hydroxychloroquine by weight, neither does Dr. Michelle Petrie. We dose it by checking blood levels. But those patients who were on less than 5 mg per kg per day had a 6 times increased risk of flaring from their lupus nephritis. The problem with lupus nephritis flares is that we have permanent destruction of nephrons. Nephrons are the microscopic filters in the kidneys. Every flare that patients have permanent destruction of some nephrons, and we can never get them back. So we want 0 flares. Tip number 5, if your doctor finds that you have an increased amount of urine protein, when we're doing it every 3 months or every 6 months for some patients, but every 3 months is optimal. If we see an elevated urine protein and we tell you that we need to have a kidney biopsy to figure out if you have lupus nephritis or not, and if you have lupus nephritis, what type, please get it as quick as you can. It's a very safe procedure in the vast majority of patients, and it's the only way we know if someone truly has lupus nephritis and how to treat it if they do. If there's a 6-month delay in doing a biopsy of the kidneys, it increases the risk of end-stage kidney disease 9-fold. 6 months delay, you're 9 times as likely to end up going on dialysis. So don't delay that kidney biopsy if your doctor recommends it. Tip number 6. If you're newly diagnosed with lupus nephritis, or if you have lupus nephritis now and it's not under complete control, ask your doctor to be on triple immunosuppressant therapy. Now, what do I mean by that? The American College of Rheumatology recently came out with lupus nephritis treatment guidelines, and as part of the references that Kelly's going to post up, but one of their number one recommendations is that patients with proliferative lupus nephritis, class 3 or class 4, they should be on 3 immunosuppressants. Steroids initially, because that's the only thing that works quickly. Mycophenolate or cyclophosphamide. Mycophenolate is preferred. It's also called Cellcept. Or number 3, a third agent, either Benlysta, which is belimumab, which is one of the FDA-approved drugs for lupus nephritis, or a drug called a calcineurin inhibitor. The 2 calcineurin inhibitors we like to use are either Lupkynis, which is the other lupus nephritis FDA-approved drug, or tacrolimus is the other most common one that we use. But you want to be on 3 of those agents. Steroids plus mycophenolate or cyclophosphamide plus Benlysta or a calcineurin inhibitor. But also you want to be on vitamin D and hydroxychloroquine. We don't want to forget those. So next, tip number 7. And by the way, the reason I mentioned tip number 6, you may say, well, my doctor should know how to treat lupus nephritis. Well, there's over 100 different causes and types of arthritis, and it's impossible to be an expert in all of them. So most lupus doctors or most rheumatologists are not lupus experts, and many of them don't know that using 3 agents is the best way to do it. So be proactive in your own health care and just tactfully ask your doctor, show them the new treatment guidelines, and that can help get you the best care possible. So tip number 7, also, if you're newly diagnosed, advocate to get less steroids. Steroids are the number one cause of side effects in our patients, things like infections, heart attacks, strokes, broken bones, and the list just goes on and on. We now know that we can get away with much smaller doses of steroids than we did in the past. What we did a few years ago is we would usually give 1,000 milligrams or 1,000 milligrams of IV Solumedrol or methylprednisolone daily, 3 days in a row through IV. We call it pulse IV steroids, and then followed by 1 milligram per kilogram per day of prednisone, which was usually like 60 milligrams of prednisone. Well, we now know from lupus nephritis studies that we can get away with just 250 milligrams to a maximum of 500 milligrams of IV Solumedrol, so much lower doses as pulse steroids, and then follow that up with only 20 to 25 milligrams a day of prednisone. And then we can also taper it much faster than we did in the past. And that's also in the new treatment guidelines, which I completely agree with. Tip number 8 is adherence. And I've been mentioning that over and over again. Take the vitamin D religiously, the hydroxychloroquine religiously, because that's how you're going to increase your chances of a complete remission or the chances of not getting lupus nephritis in the first place. Why is this important? The lupus patients that are watching this right now, only 1 out of 3 of you are taking all of your lupus medications regularly. 2/3 of you are not, and we do know that from multiple studies, especially a recent large one that was done that looked at a computer base and pharmacy fills of medications. So only 33% of our patients are taking all of their medicines religiously. Make sure you're one of those 33% of patients. If you have trouble remembering them, consider PillPack. That's what I recommend to all of my patients. PillPack is PILLPACK. I use it myself. I take about 20 medicines a day. They come in little packs. Like I have one this morning that says 8 a.m. and has all the pills already in it. Tonight I'll have another one for my 8 p.m. medications. Saves me an hour every week. I don't have to keep organizing all my medicines. I love it. So if you have trouble remembering, that's my biggest recommendation. Okay, so tip number 9 is follow my lupus secrets. Go to lupusencyclopedia.com and just click on lupus secrets, and I have a list of do's and don'ts, and I guarantee if you follow everything on that list, you will control your lupus better than if you didn't do them. It includes things such as how to eat an anti-inflammatory diet, practicing mindfulness every day, breathing exercises. It actually has positive health benefits. Also, all the previous recommendations, avoiding supplements that say that they boost the immune system. Ignore any of your friends or family that try to tell you, oh, take this supplement because it helps your immune system. That can be dangerous for lupus because it's already overactive. And I do have a blog article listing those supplements which are dangerous for lupus patients to take. So go to my website and just print out my lupus secrets and follow them. And then lastly, unfortunately, some of you watching this do have lupus nephritis or do have what we call chronic kidney disease. If you don't have chronic kidney disease, means you have some damage to your kidneys, and it can vary from stage 1 to stage 5. Some of you, it is from your lupus nephritis, but many of you, it could be from high blood pressure, diabetes, hardening of the arteries, and other things. You can decrease how quickly you lose kidney function over time. And because of that, I put up a blog article that lists all those things on how to prevent the worsening of chronic kidney disease, but I'll list some of them. Number 1, consider eating a plant-based diet. It's very hard to do for many Americans because we're used to that meat, but if you can get used to eating mostly plant-based foods, fill up 2/3 of your plate with whole grains and vegetables and fruit, you're going to do much better kidney-wise. Avoid ultra-processed foods. Ultra-processed foods have been shown to hurt kidney function and increase the risk of lupus flares and even the onset of lupus. A Harvard study from a couple years ago showed that family members of lupus patients and other people with autoimmune diseases, those family members who ate a diet high in ultra-processed foods were significantly more likely to develop an autoimmune disease. So no wonder we're having more autoimmune diseases these days with all the horrible processed foods we have. Drink 8 to 9 glasses of water a day. You want to stay hydrated. When I see a decreased kidney function unexpectedly in one of my patients, the first thing I ask them to do is drink 9 glasses of water a day and repeat it in a week. And oftentimes that's all it took to increase their kidney function. Try to maintain a normal body weight. So a BMI less than or equal to 25. Of course, that's not perfect. So if you're muscular, for example, you can get away with a higher BMI. But most lupus patients, by the way, have too little muscle mass. We call it sarcopenia, and they should be significantly less than 25 to be at a healthy amount. Make sure you have a normal blood pressure all the time. And always, everyone watching this with lupus, you should have a home blood pressure reading or a home blood pressure machine. The American College of Cardiology now recommends that we as doctors that we go by our patients' home blood pressure readings instead of the ones we get in the clinic because they're overall more accurate. So check your blood pressures at home, and you want to always see that top number less than 120. 125 is too high. 130 is too high. And the bottom number should be less than 80. If you're getting numbers higher than that, you need to take those numbers to your doctor and say, please, can we do something with my blood pressure medicines to get this under better control? Either going up on doses or even adding a medicine. If it takes 4 blood pressure medicines to do it, that's much better than going into kidney failure. Also do 150 minutes per week of moderate aerobic exercise. Exercise increases blood flow, and that's actually a way that you can also help with memory. You're getting more blood flow to the brain. Well, same thing with kidneys. You're getting more oxygen and nutrients to the kidneys. No cigarette smoking. Make sure you decrease your cholesterol. And a very important concept, by the way, is know your numbers. Ask your doctor, what should my cholesterol be? What should my LDL bad cholesterol be? And usually it's less than 100. And so if you get your cholesterol results and you see an LDL cholesterol greater than 100, you should be asking your doctor, well, what can I do to get this LDL cholesterol better? Be proactive for yourself to reach your targets. And then the last thing I'm going to mention before I'll open it up to questions and answers is avoid things that can hurt the kidneys. Non-steroidal anti-inflammatory drugs, avoid them with a 10-foot pole. So Advil, Aleve, ibuprofen, naproxen, there's a big long list. Write it down on your intolerance list. All lupus patients should always carry around an up-to-date medicine list that has all the medicines you're regularly taking, but also your drug intolerances, which you should be including sulfate antibiotics, which can flare lupus. But also, if you have any kidney problem at all, put on their NSAIDs, non-steroidal anti-inflammatory drugs. And then there are other things that are harmful, like Chinese herbs. Never take Chinese herbs because they have been known to cause kidney failure. So I hope that you get a lot out of the tips and tricks I just gave you. I guarantee you'll do better if you do practice them. And otherwise, Kelly, I'm open to answer any questions anyone may have. And I hope I didn't overload people with too much. And I can't hear you.
Oh my gosh, my fingers were on fire because I was trying to keep up with all of your pearls of wisdom and getting them out to them in the chat box here. So a lot of the references, we have them here. I was posting your website and trying to keep hopefully up along with the stuff that you sent me. So we have a lot of people joining and we have some questions here. So first of all, Misty's here and she's been waiting very patiently. And Misty's question is, what are the signs of kidney flares? Because you mentioned you don't really know what's happening in your kidneys until it's almost too late. So what are the signs of kidney flares?
Absolutely. 90 to 95% of the time, Misty, there's no symptoms whatsoever. And that's why we want to be monitoring your kidney function, which is the estimated GFR, which is a blood test, and that urine protein every time that you come in. But between visits, you can look for blood pressure because a lot of times kidney flare can be associated with high blood pressure because the kidneys, they excrete different chemicals and hormones that help regulate blood pressure. And if kidney function decreases, the blood pressure can go up because of that. And then it's a vicious cycle because the high blood pressure then makes kidney function worse. And so that's one thing you can follow. Also, some people do have such significant lupus nephritis or kidney disease that if they flare up, they'll get fluid retention. And so they'll start to get a lot of edema unexpectedly where their ankles will swell up, especially in the afternoon and towards the end of the day. And then they'll lay down, go to sleep, and it's much better when they wake up in the morning. That can be another sign as well. Frothy urine, not nearly as good of a sign, but sometimes extra protein in the urine can look frothy, but there's lots of things that can cause frothy urine.
Okay, so look for that fluid retention, blood pressure, keep an eye on those safe numbers. Let's see, thank you for doing that. Here we go. We had another question. I've got so many comments here. I'm just trying to, okay, this is from Meng Shin, and she's a really wonderful supporter of More Than Lupus. She says, what is your advice for those who cannot take hydroxychloroquine? A couple people commented about that, actually. She unfortunately had problems with her eyes and had to stop. I think what she's saying is being on an immunosuppressant and staying in low disease activity good enough? Benlysta did not work for her, and she is also on azathioprine.
Sure. So we don't know 100% know the answer to that. But we think that if you want to try another anti-malarial that doesn't cause eye problems, that's a possibility that it might help. But we truly don't know. The only anti-malarial that doesn't cause retinopathy is called quinacrine. And you can get quinacrine from what we call compounding pharmacies. If you go to my website, lupusencyclopedia.com, and click on About the Book, it will come up with a page on quinacrine, and you can print it out and show your doctor. It tells them how to get it and how to follow it. Could quinacrine possibly have the same benefits as hydroxychloroquine? Possibly, but we just don't know because it hasn't been studied in as much detail. But that's one thing I would offer my patient, just a smaller dose. My other patients, I would offer them Benlysta. So it's a shame it didn't work for you, but Benlysta, it actually targets one of the main causes of lupus, which is B cell overactivity, and it does it in a very mild way. It's one of the very few drugs that has been proven to be a disease-modifying agent, meaning that it decreases ongoing organ damage in our lupus patients. And there's only several that have been found to be a disease-modifying agent: hydroxychloroquine, Benlysta, and Safnello. So in someone like yourself, I would consider the possibility of Safnello because I know it decreases ongoing organ damage, and organ damage is associated with early mortality. So could we be possibly helping our patients live longer with these agents? My guess is probably so, but we still need the studies to show that, but it's going to take probably 10, 15, 20 years of studies before we get the answer to that question. So bottom line is I would recommend, if you were my patient, I would offer you the possibility of quinacrine and also Safnello if you're still having any active inflammation. Also, there was a nice study from Harvard, by the way, last year that showed that the biologics like Benlysta cause less infections than the immunosuppressants like Imuran or azathioprine. They're safer than azathioprine. They don't, affect the blood counts as much in the liver. We have to worry about with azathioprine. So if you were doing Safnello, could it possibly help you get off of azathioprine? That's what I would try to do in the long run.
Interesting. So it's a little bit of a dance trying to figure out what's going to work best for each patient. We are so unique. Some questions regarding vitamin D. So we've talked about vitamin D quite a bit here. Their questions are how much vitamin D? Do you take it with vitamin K? Also questions regarding testing your vitamin D. Would you suggest that the rheumatologist, not the primary care, test the vitamin D? It seems to be that there is some dissonance between treating vitamin D from a perspective of a primary care versus treating vitamin D deficiency from a perspective of a rheumatologist. What are your thoughts on that?
And you're absolutely right. In fact, you're going to find a lot of rheumatologists who don't believe in vitamin D, but that's also because they don't know the literature, the lupus literature, nearly as much as lupus experts. Lupus experts, almost all of them are going to want to do the same thing that I'm recommending because we know what the research studies show. So basically, figure out which doctor is going to be your best advocate for using vitamin D. That's my biggest recommendation from that question. Then how do we actually do it? If I find a vitamin D level that's less than 40 nanograms per milliliter, I put that person on vitamin D. To me, it doesn't matter if it's over-the-counter vitamin D3 or prescription vitamin D2, which is prescription, because they both accomplish the same thing, and that comes from those 3 studies I mentioned earlier, because both of those were actually used. Some people, it's a lot cheaper to do over-the-counter because their insurance copay is too high. Some people don't have to pay anything for their prescription, so that's the best one for them to take. If you choose to do over-the-counter vitamin D3, though, my caveat is always stick with the same brand, because different brands of vitamin D3 have widely varying quality. They have anywhere from 25% of what they say they have to 75%. So just always stay on the same. So I put someone on vitamin D for prescription. It's usually 1 capsule once a week, which is 50,000 international units. It's over the counter, depending upon how severely low it is. I'll recommend anywhere from 1,000 to 5,000, and your doctor would know what to do. And then it takes 3 months to figure out what the level is going to be. So 3 months later, I repeat it. And then if it's not 40 yet, I go up on the dose. But I also don't want it to be too high. So if it's above 59, then I would want to go down on the dose. And then I follow it every 3 months, and I can juggle around the dose until I reach the perfect dose. Even after I reach the perfect dose, though, Kelly, I still monitor that vitamin D, because I catch those patients who become poorly adherent to their vitamin D. And if I can get them to be adherent, I know they're going to do better with their lupus.
Your patients can't hide anything from you.
That's right. They know I watch them like a hawk.
You do.
Same thing with
Okay.
hydroxychloroquine drug levels. I use that the same way.
Yes, 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 yes. So Amy is here joining us, and she's asking about, you said get a kidney biopsy. It's the only surefire way to know exactly where you're at with your nephritis classification and if there's any damage. She's asking what's involved in a kidney biopsy? How is it done? What's the recovery time? I think there's a lot of fear of the unknown when it comes to when you hear biopsy. You think they're going to take a big chunk out of your organ. Could you tell us a little bit about the process for that?
Sure. So first of all, by far the most common side effect or complication is bleeding. And so you want to do everything you can to prevent bleeding. And that's by not taking things that can increase bleeding. So make sure you're not taking aspirin. Also, a lot of over-the-counter supplements increase bleeding. They include turmeric, curcumin, ginger, and the list goes on and on to just stop all over-the-counter supplements to be safe at least 10 to 14 days before your biopsy. So that's advice number one. I've actually had a liver biopsy, which is done very similar to how a kidney biopsy is done. So I'll tell you my experience. Make sure you go to a doctor who will give you light sedation. There's places that don't do that, but believe me, I want to be, I don't want to and I don't want to feel any pain when they're doing it. So make sure you get one done where they do light sedation at least so that you're comfortable throughout the entire procedure. And then what they do is they numb up, the kidneys are right at where the lower rib cage is in the back, and they numb it up with some anesthetic first, the area that they're going to put the actual needle through. And then it's a very thin needle that they put through the skin and through the muscle wall and then into the kidney. They grab a small amount of kidney and pull it out. And hopefully they're going to do that quite a few times, like maybe 10 times or so, to make sure that we get an adequate sample. But hopefully you won't even notice any of this because hopefully you're under light sedation when they have it done. And then afterwards you'll wake up, they'll put compression on it. Usually you just go home very soon after you wake up. If there is bleeding, then they'll keep you in the hospital. But the vast majority of people do not get any significant complications. Very safe procedure, even during pregnancy.
Just to reiterate, what I'm hearing you say is they're not cutting into you, they are putting a needle into you.
Correct.
That takes out a very small, microscopic, just cells so they can look, right?
Yep, exactly. It's a thin needle, and they get just a small amount of tissue.
Yes. So for everyone that has thought they're going to have a scar from this is a needle. This is a needle. Yeah.
Yeah, good point.
Yes, yes. Okay, great. Let's see. Where are we here? There's so many comments. Just thanking you for your time. Oh, this is an interesting question. If you have kidney stones, are you more prone to lupus nephritis?
Good question, Amy. And, in medicine, nothing is impossible. So all I can say is probably not, or there's no study showing that there is any association whatsoever. And I suspect that there probably is not, because it's not really, I can't theoretically think of how kidney stones would increase immune system activity within the kidneys. So that's my answer for that.
Good questions. Let's see. This is Erica joining us. I have my first rheumatology appointment tomorrow for suspected lupus and/or Sjogren's. Anything specific I need to bring with me? Questions to ask? What should I expect?
Boy, that's a great question, Eric. And this is one you could probably ask all the people watching this to get a better answer than from me. But what I would recommend from my end of things is, number one, write down your symptoms that you've had over the years, but do it briefly. Some patients come in with 10 pages of notes, and it's impossible for me to read 10 pages of notes. But like if you've had fatigue, write fatigue, how long you've been having it. If you have dry mouth, right? Dry mouth, how long you've been having it. Dry eyes, how long you've been having it. Do you get a rash out in the sun? Write it down. Do you get sores in your mouth? Write it down. Do you get chest pain when you're taking a deep breath? Write it down. If you do, your fingers turn white or blue with cold exposure, write it down. Do you get joint pains, and which joints get painful? And are you stiff in the mornings when you wake up? Briefly write that down as well. All the things I just mentioned are things that are common in patients who have Sjogren's and lupus. Number two, do you have any family members with autoimmune diseases? Because the genes that there's around 200 genes that we've discovered so far that actually cause lupus, but those same genes can cause other autoimmune diseases like Sjogren's disease, rheumatoid arthritis, thyroid disease, multiple sclerosis. So any family members who have those, write it down so your doctor can see if there's other people in your family with autoimmune diseases. So I'd say those are some of the biggest ones. And keep taking on your list of medications and the usual things. Can you think of anything else, Kelly? Because I mean, you've been there, done that numerous times.
Well, make your moans measurable is what I like to say. Make your moans measurable. So how long you've had a certain pain. Sleepless nights, but how long the fatigue has lasted, how long does the joint pain take to come out of, get stiff in the morning. Make your moans measurable. I am assuming doctors like to measure things.
Absolutely. And you're right. Like if you have joint pain, say where is it? The knuckles, middle joints, but also how severe is the pain on a scale of 1 to 10, where 10 is the worst pain you've ever had in your life. 1 is a pain you can barely feel. So just write down like 5/10, which means 5/10 severity pain. You can make it very brief like that.
Yeah.
But it's very helpful to the doctor.
Yeah, I like to take pictures too. So when my Raynaud's is really bad, or I have a sore in my nose, if I have a joint that's really swollen, because if I can't get in to see the doctor for a few weeks or even a few months, I want to be able to show them this is what happened last month, or this is what's happening quite a bit. It may not present today in the office, but this is how it was 2 days ago, or whatever the case may be. So I like to take pictures too and keep those in a folder for my doctor.
And that's the beauty of the modern smartphone era. I love it that patients can show me pictures. It can make a huge difference.
Yeah. Okay, Misty wants to come see you, Dr. T. Where are you located, and do you accept out-of-state patients?
Misty, I love your picture. You two look very happy in that picture there. Well, Misty, I would love to take care of more patients, but as I get older, I have less energy to do things, and so I've actually gone into semi-retirement and don't accept new patients. I take care of all my older patients, but I'm trying to get below 60 hours a week. That's what I tell everyone, because I love what I'm doing and what I do, and I find it hard to say no when people ask me to do things like today. I love Kelly and helping out, but unfortunately, I can't take on new patients. I wish I could.
Yes, I'm sure if you did, you'd have a very long waiting list as well, because we love you so much. We have Krista asking about heart, and due to time, Krista, I'd really encourage you to check out last month's symposium that Dr. Thomas did, getting to the heart of the matter, because he breaks down all the ways that lupus can impact the heart and how you can be proactive with your heart health. Because that was wonderful, and that's available on YouTube and on our Facebook page and Dr. Thomas's Facebook page as well. And let's see okay. Well, this is interesting. What is the life expectancy of a lupus patient?
Goldie, I have good news. With proper treatment, the vast majority of lupus patients will have a long, normal lifespan. That sounds just the opposite of what I mentioned earlier, huh? It's the 16th most common cause of death in women overall. But those are driven by problems like lupus nephritis and poor adherence to therapy and things like that. Patients who are very good with their therapy, take their medicines religiously, exercise, eat properly, they live a long time. I have one patient I think she's 93 or 94 now. I have several who are in their 80s. I have multiple patients in their 60s, and I'll never forget one of my patients. She sent me the loveliest thank you card a few years ago. She's one of my longtime patients. I took care of her for over 20 years, and she gave me this thank you card that said, "Thank you, Dr. Thomas, for taking good care of me. You know, I truly want to live a long time because no one in my family has lived past the age of 60. Because in her family, there's a lot of severe lupus, and they died before they became 60 years old." The beauty of that card was she was 72 years old when she wrote it. But she's one of those patients who does my lupus secrets and does everything religiously like I ask her to do. It's in her power to do better, and she's doing all the right things. And I know you can too, Goldie.
Yeah, that is such a great way. Well, maybe we should end it on that positive note. I did post your Lupus Secrets link, and maybe I'll do it again just for good measure. People, please check out the Lupus Secrets. They absolutely are life-changing for a lupus patient. I love the section on sleep hygiene as well. I always try and get my good sleep hygiene in order if I'm thrown off for travel or whatever, because I think it makes such a difference. Everyone is saying, thank you. This was this was so informative. I'm going to go back and watch this. So I just want to say once again, thank you for your time, Dr. Thomas. I know that you are a very, very, very busy person. You are so inspiring to us, and we appreciate you taking the time to come on here with us to talk about kidney health. And if people aren't following yet, Dr. Thomas, where can they find you?
Go to lupusencyclopedia.com, and you can enter your email when the pop-up comes on, and then I'll send you an email when I put up new articles and new posts and so forth. On Twitter, I go by Lupus Encyclopedia. I leave out the EM just because they restrict the number of letters. I'm always putting up new things about articles and research and so forth. So those are the two big ones. I also have a Facebook page, Lupus Encyclopedia, as well. And I also post a lot on Reddit. If you're not on Reddit, the subreddit, Lupus subreddit, it's really good. Lots of great people on there, but I also chime in quite a bit when people ask questions.
Wonderful. And Peggy's joining us, and she said, I missed the first 20 minutes. How can I watch this again? Well, good luck for you, because it's going to be on our Facebook page. As soon as we're done, you can watch it from the beginning, and then we will upload it to YouTube, and you can watch it on YouTube and share it if people do not have Facebook and you'd like to share it with people there. So thanks again, Dr. Thomas. We look forward to having you back again, hopefully soon, and enjoy the spring weather. And we will talk to you soon. Thanks so much.
I like to end with one thing. Everybody, please join a lupus advocacy group. We need to stop lupus from being the 5th most common cause of death in young women of color. We need to get the public to know about lupus and to give research dollars. So join advocacy groups like More Than Lupus. Thank you so much, and goodbye.
Thank you, Dr. T. Well, there you go. What a great presentation once again by our favorite rheumatologist, Dr. Thomas. As promised, for those of you who wrote shared in the comments, who shared this live on your personal Facebook page, you right now have the chance to win a copy of this 2nd edition of his best-selling handbook, which is a comprehensive guide for people with lupus, those who love them, for medical professionals, and beyond. So, once again, I'm just going to make sure I didn't miss anybody here. If you shared this, write shared right now. I'm going to enter you in. You do have to live in the US, just because it's really hard to ship. I'm going to get your address, so you private message me your address as soon as we're done here, and I'm going to actually ship it straight from Amazon. It is just easier to do it that way than to. Okay, Misty, I got you in there, Misty. I did not get you, Krista. Great, thank you so much. And then you can go back and watch this from the beginning as well. You are very blessed to have him as your doctor. Wow, okay, fantastic. Okay, Wanda, Did I get you in there? Did you share, Wanda? I thought I saw that before. And anybody else here before I do the spin? Show again. This book. Is that you want me to show? There you go. There's that. Okay, everyone. If you have shared this, I'm going to give you just one more couple seconds here to say shared in the comments, and then I will do the spin the wheel. I have an app that I use that's very reliable. So, thank you, Jane. You are so welcome. Thank you, Anita. Good to see you here. I got that one. I got that one. Mimi, did you share? Misty, I have you in there. Goldie, did you share? I want to make sure I don't miss anyone. Jill, did you share? Erica, did you share this? If you write shared, then I can put you into our spin the wheel. Oh, okay. Got it. You know, it might work. Okay, Brenda, let me add you. It might actually work in Canada, Krista, but I just can't ship overseas. So we'll just see. Brenda, thank you. I can try Canada. I can try. We will see. You already have it. Fantastic, fantastic, fantastic. Okay. Brenda, it is in, you can get this on Amazon as well. Okay. You own it already, Amy. Okay. All right. All right, guys. Here we go. Thank you so much for taking the time out of your Saturday to join us for this life-saving information. I hope you found it helpful. As I mentioned, you can watch the whole thing in its entirety on YouTube, on the More Than Lupus YouTube channel, or you can stay here. Once we're done, just restart the video and you'll be able to watch it from the beginning in its entirety. Let's see who is going to win the drawing. If your name is drawn, send us a private message immediately with your address and I will get it out to you, okay? Spin the wheel. Here we go. Can you see it in there? And who was the, Jennifer? It is Jennifer. Okay, Jennifer, I hope you are still watching here. Jennifer was the winner. So please send us your address and we'll get this out to you. We're so thankful for you joining today. We had a great group here live and we'll see you next time. And don't forget, if you are part of the More Than Lupus community and you want to be a part of our online Zoom support group, it's happening in 1 hour at 3. So if you are a part of our community and you did not get the link or you would like to join us to have some more intimate conversations and kind of catch up with the community members, it's a wonderful place to connect. Please let us know and we'll get you the Zoom link, but come back here in 1 hour for Zoom support group if that is, you knew who I'm talking to, who's joining. Okay, so that's it for today. Have a great one. We'll see you next time. Bye-bye.